Hi, everyone. Welcome to Dialogue with Khuraira. Dialogue with Khuraira is a platform created to celebrate unsung heroes. Who are the unsung heroes? These are individuals doing incredible things in their various communities for the betterment of humanity. Why we call them the unsung hero? Probably because the spotlight is not on them. You might not hear of all the amazing things they're doing every day. We find out about them through referrals or their social media activities or even just them reaching out to us. This month, October, is the Breast Cancer Awareness Month. Anyone that knows me, I'm a huge advocate for breast cancer awareness. Why? Because my business as a makeup brand executive, many women that support my business, many customers, I would say clients that support my business are women. And I have over the
I
years,
can't hear you.
I've met quite a number of people that have been affected by this horrible illness. So we make it a point to do as much as possible to give awareness on how women should do early detection, awareness on how to even prevent it, or making sure that you also know your lineage, if family members have had it or what have you, just giving that awareness that we know and making sure that you're doing your annual checkup. So today we have two incredible guest speakers that will be talking to us about the activities they've been a part of in driving this awareness to core communities in northern Nigeria. And
I can see mommy, but I can't hear her. Rufai, I can't hear you too.
Okay, so we can hear one of our guests. The first one, we can hear her, but she can hear us.
Let me refresh my browser.
Umi, can you hear us? As Hajia Umar Musa. She is the founder of Arewa Cancer, I think, Coalition. It just went up, but she will be back. And we have another uh, great speaker whose foundation is 3 a.m. Foundation. Also awareness on cancer, and their target is blood cancer that has to do with blood. So we want to learn more about what that means. Um, I'm hoping that our viewers are also taking this month seriously and asking all their friends, family members to make sure that they have a checkup done annually. Hi, Umi, can you hear us? Can you hear now? Can you hear us?
I can't
Uh,
hear anything. And my
Rufai,
mic is on. Everything is on.
Rufai, let me see. Is that working? Can she? Can you hear me? Hajia Umi, maybe you should log out and come back again.
Yes, I can hear you, Hadia. I don't know
Yeah,
what is wrong with my voice.
maybe it's her network.
It probably is not network because if it's network, we are not supposed to be hearing her. But we can hear her.
Yeah, but we can hear her.
Yes.
Um,
It's even
Hajia, Hajia Umi was here the last time, and
The the audio and the video are all breaking.
oh,
I
you, but
can't make
you,
out the sound. And
okay,
the video is also still like a picture.
okay, so it's her network then, because we can
I,
hear you.
Should I use Google Chrome?
maybe she can.
Yeah, you can use that. You can log in whichever way. You just have to follow the link. We're using
So
Google Chrome, so you can do that, right, Rufai?
Yes, Hadia, or maybe she can even use her phone. Let me talk to her.
Yeah, maybe her phone. Okay. Yeah, I usually log in with Google Chrome anyways, so I think it should be okay. Network, always an issue. I always love to to feature a lot of people in Nigeria because they have
I
amazing
can't hear
stories to
anything.
share. But sometimes it's just the network is the issue. We hardly ever get a really good sound, a clear sound recording whenever we are doing featuring people from Nigeria. Sometimes, well, also it depends on the city where you are doing. People that are from Abuja usually isn't bad. I don't know where she is now. Is it Abuja or Maiduguri? Because I think she's split her times in those areas. So let's see. Yeah, she can, if she could do the group, her phone. Rufa, I think she can also use her phone as you suggested, and she can log through the Google Chrome. That will be fine. Yeah, today is a very important topic. Would like again, the first 1 hour of the show is with Hajia Musa Umar, who is the founder of Ariwa Cancer Control Coalition. And then the next person that we're going to have is also Usaina Baba Inna. She is Hajia Usaina Baba Inna, who is the founder of the 3 AM Foundation. Last time we featured Ummi Umar over here, Musa Umar. She was right about to launch her foundation. I think we spoke her, so we cannot wait to hear update what she's been up to. They've been really working hard with collaborating with the Nigeria Cancer Society to do a huge awareness on some of the early detection of cancer, and not also, I think there's one other cancer that you can get a vaccine for. Oh my God, it's just escaped my memory. But I also want to talk to her about the true negative breast cancer, which is, I've heard, is ravishing the Nigerian women at the moment, because this disease is very, very rapid, and also mostly affect Black women, brown women, and Hispanic women. So when I learn about what is being done to have awareness on that, and what treatments do they have available at the moment. And hopefully she's back. It looks like she's totally gone. Rufai, if she cannot log in, maybe we can have the other guest, and then she can come back later. This way we don't waste the hour. We can switch them. Maybe that will work. Okay, so let's see, and yeah, if she'll be back. Yeah. Rufai, I think you can maybe see if the other guest is ready, and we can have her on while we wait for Ummi to figure out her network. Can you hear me? Yeah. The program manager seems to be off too. What's happening today? Sorry, our viewers, we are having network issues. They're having network issues back in Nigeria to log on. Again, where this month is Cancer Awareness Month, and we're trying to have as many expert or people dealing with this dreadful disease to be part of our program, to share some insights whereby we can actually educate the public on what is out there in terms of treatment, in terms of awareness, in terms of protection. And so that's what it would. If you know any person that would be a great guest, that will be wonderful, and that you can forward the information for us. We're dedicating the whole month of October for breast cancer awareness. So as many experts we can have to really educate us on what is going on, not just in Nigeria, anywhere in that expert is from, either in the US here, any part of Africa, Europe, and Asia, if they can too. It's more than welcome, because this disease affects millions and millions and millions and millions of people. To even, it's so disheartening sometimes to see even like little children are dealing with this disease. What is it coming from? Is it the food we are eating? Is it the environment? I mean, there's so many questions I would like to ask these experts. Maybe they have some answers for us. Maybe they have an idea of what is really going on. And so, yeah, if you know anyone that could be a great guest for us, please, please inbox us on Facebook or Instagram, whichever part of the social network is comfortable for you, to send us message to be to able to feature that individual. So hopefully she's okay now. It looks like she's coming back. It's going slowly, 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 slowly. You know, for me, okay, great. Can you hear now? Can you hear us now? Can you hear us now? Nadia, Omi, can you hear us now? I think it's the network. Nadia, Omi, you can't hear us. She can't hear us. Is she?
I want to try using my phone and see.
Yeah, try the phone if you can hear. Yeah, use your phone. Use your phone.
Let me see if my phone will work.
Yes, yes, better. Yeah, sometimes. Are you in Maiduguri? Let me see if I can send her a message. If she's in Maiduguri, maybe with what just happened recently with the flood, maybe that is another thing that is affecting her network.
Yes, mommy, I'm trying to log on with my phone now.
Okay, good. Yeah, we can hear you now. We can hear you.
I'm using a separate network for the phone.
Okay, perfect. We can hear you. So let's do the phone. Network. If there's something that will really help, especially in the world of social media and how everybody is like interconnected. I think the huge favor a country can do for its citizen is to making sure that they have a great network for people, for easy connectivity. be it business, be it awareness, be it education. Now people tend to use a medium of Zoom, Skype. Now we're streaming. Literally, we're in 3 different platforms coming from one source. So it's so important that.
Um, since you both can hear me, it is not loading on my phone too,
Oh, it's
and I'm
not.
using a separate network, so I
So
don't know
you're in Medjugorje.
if mommy can be typing her questions on the chat, and then
Oh,
since
I
the
see.
audience can hear me too.
Okay, let me
I don't know
see.
if that's workable, Rufai.
Yeah, probably that's what I will end up doing. So let me see. It is not. Rufai, the chat is okay. Oh, okay. Let me see. Is it possible for her? Can she be on the? Oh, good. Um, Let me add. So right now, please. Oh, she's here. Please give us. Please give us update on what your NGO been working on. Been working on. So hopefully she can see. Please give us updates on what NGO has been working on as a network. So yeah, the network, and now she's off too. Yeah, it is the network. She had already said that she had tried. So I'm typing the questions, and it looks like she's offline as well. And then the other guest is not here. This is no good. So let's see if this one doesn't work out. Maybe we'll be able to. We have to get the other person to join earlier, or we have to reschedule for next week. Hopefully, we can get a better network. But it looks like for the past almost 20 minutes, I'm talking to myself here. Okay. So she's offline at the moment. Okay, you're back. So she's back. Hopefully she can. Hajia Umi, if you heard, I said, please give us update on what your NGO has been working since you launched it last year. Hopefully you've seen the chat. If you could give us update on that, what you guys been working, because we can hear you. It's just that you can hear us. Okay. Erufe, are you there?
Yes, Hajia, I am here and I can hear you loud and clear.
So where's the other guest? She's not available?
Yeah, all of them were supposed to be here, and we just spoke with them. They say they are going to be here, so I don't know. Maybe it's the network or something that is stopping.
They're both in Maiduguri. Are they both in Maiduguri? I think my people, network hasn't been good to us. I would think that we're going to call it a day. It looks like both guests are not
Assalamu
in an.
alaikum, mommy. Good evening.
Oh,
Rufai, good evening. I am sorry about the network. Um,
we,
Alhamdulillah that you can hear me. So I think I
yeah,
can proceed. You said I should give an update about what my NGO has been doing since the
yeah,
launch.
yeah.
Um, I have been working as an advocate for the past over 2 years, but we made it official last year, October. This week is exactly a year when I officially started working as an organization, as a civil society organization. And so far, it's been great, Alhamdulillah. Last year, this time, I was collaborating with a major hospital here in Abuja to give discounted breast cancer screening to women. And we were opportune to screen around almost 100 women for breast cancer. I was just there volunteering while the hospital was giving discounts for breast and breast ultrasounds. I hope you can hear me.
Yes, we can hear you very well. We can hear you. Yeah, we can hear you. We can hear you. Tell her. Oh God, Rufai, maybe you should like use a
I
we.
hope you can. I can proceed. Okay.
Yeah, we can hear you clearly.
Okay. So far, that's how it's been going. And after a month, okay, mommy, I saw the message. Thank you. So after like a month, I think it became like I can't hear you, mom. So it became like something that I do over social media. I mobilize people to anywhere there is any discount on cancer screening, whether it's breast or cervical, um, or other forms of cancer. And I think I cannot pinpoint the number of people that we have touched so far, but approximately, I think we have seen about 4,000 people from last year to this year, from directing them to where they would go screen to uh, advocating and creating awareness, showing them how to prevent cancer, and also directing them to where they can get care if need be. When it comes to investigations after detecting a lump, to biopsy and to treatment, particularly radiotherapy, which is my specialty. I am sorry I didn't even introduce properly.
Yes,
My name is Umi Musa Umar. I'm the founder of Call of Cancer Initiative. It is a cancer advocacy organization based in Abuja, but we try to work through social media all across Nigeria and even beyond. I specialize in radiotherapy and also public health. And last World Cancer Day, I inaugurated Arewa Cancer Control Coalition. That was when I came to this show to talk about the coalition and our goal in the coalition. So so far, through the Arewa Cancer Control Coalition too, we have been trying to primarily reach grassroots community. Even though we launched just first on the 1st of September last month to officially begin operations around the 19 states and the FCT, the 19 northern states and the FCT. It's been a roller coaster because reaching the grassroots is not easy, but we are still on it. We're still seeing how feasible it is with the challenges of security, finances, distance, safety, and all. And with the fact that I have my primary job, I treat cancer at National Hospital Abuja. So I juggle between my work, my job, and also um, managing my NGO and also the coalition. Uh, After World Cancer Day, I continued working as an NGO through Call of Cancer, and I took some communities within Abuja that are more like grassroots. For example, in June, July, uh, we had the Ruga outreach where we went to nomadic Fulani communities across Abuja to look at the health inequalities associated with the way they live, the way they are like, not completely a part of the community per se, because they live in an isolated way. They have a totally different lifestyle and they seem to be very conservative. So, through my specialty for public health, part of my assessment is I chose to look at the nomadic Fulani community, which is the Ruga communities, and that was how we made it an outreach. It's been a success, even though we are hoping to get back to them more than we have so far. We try to educate them on screening, on symptoms, on preventive measures, and also educate them on the fact that cancer is not a spiritual attack per se, because
That's usually what they
I hope
say,
you can
you
hear
know?
me,
Yeah,
because
but you're
we
right about
noticed
that.
that that's their own belief that cancer is a
Yes,
spiritual attack, and anything from fever to infections are usually associated with the word daji.
yes. There's like someone had poisoned them, or it
The
was,
stick.
yeah,
Can you
yeah.
hear me?
I can hear you. We can hear you. Yes, yes, we can hear you. Yes, we can hear you. We can hear you. We can hear you. Can you see us? Or maybe,
Okay. All right. That was it, and we took note of part of the communities in the Ruga settlements that need more help, and we are planning. Okay, thank you, mommy. I saw that, and we are planning to get back to them. For example, this October, that we have some places that are offering discounted mammograms, discounted breast ultrasounds, or even free mammograms, and also some tests that are markers for cancer. We are planning to carry them along by arranging for transport services to go pick them up and take them to where they can get the services, and also follow up with them and make sure that they follow through, especially for the results that turn out to be probably suspicious or even negative, or I would say positive for cancer. So something like that. So madam, I'm in a show. So this month of October, through Arewa Cancer Control Coalition, we collaborated with a diagnostic center, Parfait Diagnostics in Asokoro, that is providing discounted cancer tests, blood tests, and also breast ultrasound that are kind of like cancer markers. And they're willing to give us up to 50-60% discounts on different screening tests, including prostate cancer. When we launched, we pledged 3 months of continuous advocacy. For now, our target is Northern Nigeria, but hopefully in the future we'll expand. Definitely will expand. So we launched to make it for 3 months, and to be purposely for breast, cervical, prostate, liver, um, and also blood cancers. So on the day of the launch, we had a blood drive, which was a success in Abuja. We had a lot of donors that came. We
Oh,
collaborated with National Blood Service Agency, and
mm-hmm.
they came. We provided or mobilized donors, and we got some blood donations that are specifically for cancer patients that are in need of blood. We
Yeah.
all know that one of the major challenges that comes with treating cancer is anemia.
Oh, wow.
People that are undergoing cancer treatment tend to lose blood and tend to need blood, and sometimes that can be fatal because before they get a matching blood, it might be too late, and we end up losing them because of
Oh,
lack of blood. So that's what we looked at and thought to do that collaboration, and alhamdulillah it went well. We launched the 3 months long advocacy and also had a successful blood drive, and then we kick-started. That was when we joined Perfect Diagnostics, and right now, apart from the show that we launched this week, which is Let's Talk It Out, shamelessly and unabashed. Shamelessly because we think we have a culture of, trying to, avoid talking about these things because we feel like it is shameful because
yeah.
we are Hausa, Fulani, blah, blah, blah in the
Mm-hmm.
north, and we are very conservative. And one thing is to change the mindset of our community. Anything that concerns our health,
Yeah.
shame shouldn't make us to avoid talking about it.
Yeah.
Shame shouldn't make us to shy away from addressing those issues
Mm-hmm.
because people are dying from these diseases, and there's no way we can hide under shame and just keep quiet and let the community suffer. So that is why we're trying to use that medium to create awareness. We stream live on Instagram and Facebook, and
Yeah.
we've had 2 episodes so far. Tomorrow will be our episode 3. We have been having guest speakers, special guests come in and talk to us, people that are very experienced in the cancer space
Mm-hmm.
and people that have been in this for a long time, so that we learn from their pool of experience.
Yeah.
One of the major things that we are targeting this October is to um, is to teach women or create a culture of breast self-examination. I've realized that a lot of women here, like most of our women apparently,
Mm-hmm.
hardly check their breasts. They don't do it at all. So, and being from a low and middle income country, we know that we have our weakness when it comes to the healthcare system. And
Yeah.
sometimes the economy will not even let a woman, afford to go for screening. So at least when a woman checks every month the way it's supposed to be, the right way, it tends to decrease the mortality rate because
Mm-hmm.
um, we the lumps or any abnormality gets detected early, and that's the whole point. For we can't stop cancer from occurring, but when it's detected early, we can be able to treat successfully. So that is what we are focusing on. We're focusing on teaching women and also encouraging them to create a culture of checking their breasts on a monthly basis.
Yeah.
Right now, we are trying to expand beyond Abuja by talking to different diagnostic centers across the northern states. Like yesterday, I got a confirmation that a diagnostic center in Maiduguri is willing to give us about 60% discount on breast ultrasounds. And another one that we're in talks with is willing to give us free mammograms in Borno State. We're in talks with Gombe, Kano, and by the coming week, by God's grace, we're going to have more centers and hospitals willing to give these discounts, even if it's for like a week within the month of October. It's going
Mm-hmm.
to help and go a long way. We have Kaduna. We have been, on our social media pages updating any place that we see having discounted, even if we are not the ones that collaborated to make them do it or they just decided to do it. We look for the information and we direct people. We mobilize people to go take advantage. People that are in those localities.
Wonderful.
um so
Wonderful.
far so good. That's what we've been doing, and we hope to do more by God's grace, and we hope to extend it beyond the month of October, inshallah. Mommy, do you have another question for
I
me?
do. I do. I actually, when I love what a lot of the things that you spoke about. Unfortunately, you can't hear me, but I talking about the going to the
I am
rural.
sorry, my fellow
Yeah,
guest couldn't join us. She
she
said she
couldn't.
was going to try, but
Okay,
I'm sure she was unable to.
she's
And because
also,
I called her and she didn't pick,
yeah,
she's
maybe network.
sorting out some things and she wasn't sure she was going to join.
Okay, all right. So when you were talking about getting to the rural areas,
Unfortunately, I still can't hear mommy.
yeah, and just
This is quite
okay,
unfortunate.
if even if I try to explain, Rufai, just let her know that I'm trying to recapping a little bit of what she said, just to emphasize the importance of it, so she knows what you said. Hold on. Okay, so what we are trying, what they did, especially going to the rural communities, like the Fulani settlement that she's talking about, is so true. The Fulani people, they don't believe in hospital to begin with, and they're very, very private in terms of like allowing someone to touch their bodies or what have you. So having this kind of initiative, I'm having go to their locale to really talk to them and educate them. It is also important, and also they have the tradition of marrying off their daughters early. So I think there's PV has something. I'm gonna ask her what. Let me ask her what cancer can be prevented. Cancer can be prevented via vaccine. I think that one will be a perfect one for them. Um, she and they're really up and doing with it. I know that we interviewed the president of the Nigerian Cancer Soc- um, Society, and he had mentioned that. And I know Ummi's foundation is also huge on that. So please go ahead and explain that, and explain. Yeah, okay. So it is a,
Okay.
yeah. If there's a will, there is a
What
way.
cancer can be prevented using a vaccine? Okay. Cervical cancer is one of the few cancers that have a cause because in oncology or in medicine, we cannot say this is the exact cause that this is the exact thing that causes cancer. Now, when people ask, we just try to explain the predisposing factors, which are either modifiable or non-modifiable factors. But fortunately for cervical cancer, we have a cause, which is human papillomavirus. Human papillomavirus is a sexually transmitted infection. I happen to be a member of the International Papillomavirus Society, and we undergo a lot of research on human papillomavirus, and we also advocate for the human papillomavirus vaccine. It is a sexually transmitted infection that can cause different forms of cancer, but majorly it causes cervical cancer.
Okay. So with the vaccine, it's
Okay, so I'll get
actually
back to this after I finish explaining about the vaccine preventable cancer. So, HPV is actually cervical cancer is totally preventable, being that we have a cause, and if we prevent the occurrence of a human papilloma virus through preventive measures when it comes to sexual transmission, we can actually prevent cervical cancer. And also, even when the HPV infection happens, it is just like any other sexually transmitted infection that can be treated with over-the-counter drugs. So, before it before the changes that occur to precancerous stage and to cancerous stage, it gives a very wide window for the virus to be seen and treated, or even if it's not seen and treated, for the precancerous stage to change into cancer. It could take about 6 to 10 years, arguably, depending on different literatures, to completely become cancer. So it gives a wide window of prevention before it becomes cancer. If a woman goes for her 3 yearly pap smear, it will definitely be detected as a precancerous lesion and be completely treated because it's treatable. But once it becomes cancer, then it is another ball game entirely. So it is preventable because we can see that virus through tests, screening and treat. We have the HPV DNA test, which is a very accurate test to do to check for HPV infection for women that are sexually active, or for women that have been sexually active in the past. So the vaccine, on the other hand, is a prevention from the infection and not from cervical cancer. It's from that sexually transmitted infection known as human papillomavirus. So the vaccine is to be given to girls before the onset of sexual activity, even though women that are sexually active can equally use the vaccine, but it's more effective when it's given to a girl before the onset of sexual activity. Hence, the usual window to be that it's given is from the age of 9 to 15. Before, in Nigeria, every shot of Gardasil, which is the HPV vaccine, is about 20,000 naira. The whole dose is about 60,000 naira, because for women that are sexually active, they are advised to take three shots, which is about 60,000 naira. So, but last year, that was exactly a year ago, Alhamdulillah, the federal government launched and inaugurated the inclusion of human papillomavirus as part of the routine immunization for girls. And so far, millions of girls have been vaccinated. That has proven to work in the advanced countries, because there are countries that haven't had a single death from cervical cancer in the last 30 years, in the last 3 decades, 4 decades, because of the global and the World Health Organization's global strategy to accelerate the elimination of cervical cancer, which involves a 90-70-90 strategy, which is 90% of girls vaccinated before the age of 15. 70% of women being screened for cervical cancer, and also 90% of women that has cervical cancer being treated successfully. So the three factors of that strategy is the World Health Organization's strategy for elimination of cervical cancer. It has been proven to work in different countries, and we are hoping that with the 90-70-90 approach, even Nigeria is on the right track of eliminating cervical cancer, because it's a totally preventable disease. And before I forget to ask, human papillomavirus can cause other forms of cancer, not just cervical cancer, like endometrial cancer, vulva cancer. And in case of men, it can cause penile cancer and also anal cancer for both male and females. There are also some form of head and neck cancers and oropharyngeal cancers that can be caused by human papillomavirus. So in advanced countries, even boys get vaccinated with the human papillomavirus vaccine. So it is not only for cervical cancer, but being that the highest occurrence of cancer from that virus is cervical cancer. That is why it is being just looked at as the cervical cancer vaccine.
Okay, wow.
She said Fulani don't allow people to touch their bodies because of
this is very educative.
believe in
Very,
hospital, social life.
So it's really very, I mean, if there's somebody that asking question, because people are also asking question or making comment, you can address it. I just sent you another question. So if you want to address that, I don't know how prevalent it is in Nigeria, but I know that but this is very, very important, That is the papilloma virus. I couldn't figure out the name. I'm like trying to remember it, but I had like Dr. Um, Alasang Adamu, Umar
Thank
Adamu,
you.
who also was
Thank you,
who
mommy.
was also the president of the Nigerian Cancer Society. He was here also, he had explained about it. We had another gentleman who's an RN from Ghana who also explained about it. And I think like why I was saying that this is so important in those such communities is that this vaccine ought to be given to people before they become sexually active. So for like a community like the Fulbe community who are like the marry of the girls so early, it's a very very commendable thing that your coalition your organization had done. Yeah, it's also in terms of getting to the because of network or traveling security. If you will be able, people that are hearing this our interview, if you could reach out to Hajia Umi Umar, Musa Umar of Arewa Cancer Control Coalition will be great because she will need to partner with people in various communities, especially in those communities. So that way, who she will be able to reach as many people as possible. So let's talk about triple negative breast cancer because this is to be treated in a society. Okay. Um, yeah. So if you could answer us regarding triple negative breast cancer is huge.
Okay.
Yeah.
I don't know if I should proceed. I saw a question about triple negative breast cancer in Nigeria.
Yeah. Yes, please. Yes. Yes, please. Yes, proceed.
Okay.
Yes, proceed. Yeah, we're listening. I,
Okay. Okay. So I can proceed.
yes.
Breast cancer generally is seen like a death sentence, and not just that, it is also seen like a stigma for women. I don't know whether because it comes with mastectomy, at least women that have cervical cancer don't have anything that is visibly taken from their bodies. So maybe that's one thing, or definitely that's one thing that affects women when it comes to breast cancer and make it more um, challenging for the patients and for the caregivers also, because that means you also don't just take care of the medical aspect, but also the psychological aspect of it. But then, triple negative breast cancer is not a death sentence. All breast cancers or all cancers are not a death sentence. That's the whole point of early detection. As long as cancers are detected early,
Yeah.
um, there's been a rise in the prevalence of triple negative breast cancer globally, and especially in low and middle income countries. Um, there are different studies on what could be the reason, but there is a general global rise in cancer, and like triple negative breast cancer has increased from about 13% to about 53% now, especially in Nigeria and other parts of Africa. But it is harder to manage. It's usually more expensive because of the drugs, but it is still not a death sentence, and it is still not something that is scary when they say triple negative. Women should lose hope or feel like they will not survive it. I feel like we need to encourage women and let them know that because you get diagnosed with triple negative does not mean that it is hopeless. There's
Yeah.
always hope, and even with the increase in the high number of triple negative cases being seen now, I feel like that has to do with the general global rise in the occurrence of cancer, which we know
Mhm.
has been skyrocketing
Yeah.
in the last years if we look at the statistics. So for triple negative to rise between 15% to now over 50% shows that we need to look at lifestyle, because generally this has to do with the general increase in the occurrence of cancer. We also need to look at lifestyle. We also need to look at the hereditary factor. Every woman that has a maternal relative ranging from mom to aunts that has had cancer before, bilateral breast cancer, or
Mhm.
different women in the same family having breast cancer or having reoccurrence of that cancer, means there's a need to look at the gene factor. There's a need to look at the hereditary factor. Even though I know that the tests that would show that those genes are quite expensive in this part of the world. But knowing that you have a family, that hereditary risk will make a woman to take more precautions, and generally take better action, or take more intentional decisions to go for screening on time, to never miss your screening, to do your breast self checks, and make sure that even if you have it, it gets detected early. That's just the whole point. I think the whole point is early detection, whether triple negative or not.
Yeah. Exactly. It's very important. You said it right. And our next question is
What
what?
causes the rise of cancer in recent years? Well,
Yeah.
there's
A
definitely
lot
a
going.
rise
Like,
in cancer. Even the advanced countries can attest to that. I don't
yes.
want to go into the technical factors and statistics, because we all know that even from hearsays, that before you could go years before hearing that someone has cancer, it is kind of like it was a rare kind of disease that people find, wow, this person has cancer. But now it has been like almost every day in the news
They
here
try.
locally and even internationally.
Yes.
And like in my line of work, I interact with patients a lot, and whenever I have patients to treat, especially when I see young women in the late 20s, early 30s battling breast cancer, I would ask them, do you have any relative? Have you had any family history of cancer? And most of them, this is not an established research, but most of the patients that I have personally interacted with while treating them would attest that they don't know anyone in their family members that has
True.
had breast cancer before.
True.
So not just breast cancer, all forms of cancer, but because breast cancer is more hormone and gene related, it is more people think it is something that irin garden shaki, it is being inherited or something like that. So, but even patients that have breast cancer would tell you that they don't have any family history. That they don't have any family history. It just happens, and there's no one in their family that has had it before. So,
Yes.
but when we look at the factors of ranging from our lifestyle, what we eat, what we drink, how we live our lives, I think that is majorly the culprit. Welcome, Mr. President. Welcome, sir.
Yeah. Yeah. Yeah.
That
Fine.
is
We
majorly the
answered
culprit.
already. Yeah.
Foods that have chemicals as preservatives, things like monosodium glutamate, sedentary lifestyle. We like to Netflix and chill now. Usually, whenever there's no work, then it's time to Netflix and chill, spend the whole day at home. We are mostly guilty of that unless we fight our own demons and then decide to take up exercise and working outdoors as part of our lifestyle, which is very good and very much recommended. And also, our kind of food now, unlike in the past where they grow their foods by themselves, everything is homegrown. Right now, we have a lot of fast food, we have high density and low nutrient diets that are usually the what do I say? Sune kama abinci mai daɗi now in our communities. There are the things that everyone looks to eat because it is cool and it is awesome. You know, it cooks fast, or maybe it's already cooked from abroad, so you just have to microwave it and eat.
Yes.
Not all processed food actually have carcinogens or preservatives that can cause cancer. Not all processed meats can cause cancer, but we know that red meat generally is a culprit, and we like to eat suya, and we all know that okay, we may not all know, but then there is evidence that suya, that especially the one that is a little burnt when they feed that it it constitutes chemical substances that can be carcinogens. And somewhere I read a research that established that even the oil that drops on the charcoal when you're grilling, and then the smoke comes up and it gets absorbed back in the meat and you consume it, that is a major carcinogen too. So I think our lifestyle is a major predisposing factor. Alcohol consumption, tobacco, we are making it now. To the tobacco industries are targeting the younger generation. So when we talk about tobacco cessation, now we're not talking about addicts that are, that are adults. We're even talking about the younger generation. We have the vape now that is seemingly cool and expensive. And people feel it is vape, it is electronic, and it's nothing. Meanwhile, it is even more dangerous than the regular cigar.
That's what I heard.
So I think we are gradually moving into a generation where a lot of things that are harmful are seen as cool and awesome, and we have to change the narrative by creating more awareness that these things are really, really harmful, and most of them are what constitutes to the high statistics that we have today of cancer.
And it's not just
my president is here. He can give us more. He can give us more information on that.
So we're excited.
So that is that about
Nigerian Cancer Society has joined us,
Dr. Rise of cancer in recent years.
Yeah. So he had joined us. Hopefully he will give us more insight and a lot of the accomplishment that Nigeria had gotten, especially with your recent trip to Geneva. We have great news that have come.
Okay, Mommy, you want to say a few words?
Yeah. Okay. I wanted to say, okay, please do.
Awesome. Hello.
Oh, you can hear me, right? Okay.
Yes.
Okay.
Yes, I can hear.
And I don't know how I cannot hear anyone, but whenever my president comes on, I can hear him loud and clear. And then they say, Rufai says it's from my system, it's from my network. How come I can hear my president?
So is it my system maybe?
Good evening, a very good evening to you all. I do really, can you hear me?
Welcome, sir.
Fantastic. Thank you very much for admitting a get crasher like me into this show.
I saw you so much.
I was actually following just like every other person on Facebook, but suddenly Rufai had to drag me into the room. Umi has been phenomenal.
Yes.
She has done justice to most of these issues. I am very much impressed with the kind of interventions they are doing on the Arewa Cancer Control Coalition. It's just like about a month old, but they have succeeded in touching lives. They have succeeded in reaching out to, remote areas that are supposed to be the major target for cancer advocacy. You look at Nigeria, statistically, according to the World Bank statistics, over 60% of the population of Nigeria are living in rural areas. True. Over 60%, and about that same percentage also are living below the poverty line. Now, the struggle for most Nigerians is on how to put food on the table.
Yes.
And access to health care, especially the preventive services, are grossly lacking in our health facilities. They say prevention is better, safer, and cheaper than cure. And most of our population, don't have access, which is a major ingredient towards, prevention of cancer. I have been listening to Umi, and I am totally impressed with the kind of interventions they are carrying out under that coalition. I can't wait for that coalition to reach my village, because I am I'm a long ranger when it comes to my locality. Anytime I go, especially now that I have been, deeply involved in cancer activities, they see me, they see cancer, they call me Dr. Cancer, so everybody would want to listen. And I can't wait for this kind of interventions, to come to the grassroots, to come to my locality, because education is very important. And I must salute DialogueWithKhuraira for sustaining this dialogue. I remember I featured on this dialogue about a year ago. I think precisely a year ago, around August, September last year. And I have been following keenly, particularly discussions around cancer awareness, discussions around key issues, with cancer. And just like Umi said, most of these cancers that are killing our people are highly preventable. You talk about breast cancer, you talk about cervical cancer, you talk about prostate cancer. There are all these common cancers are highly preventable. And through lifestyle alone, we can go a long way in preventing most of these cancers, and thereby reducing the statistics of late presentations and mortalities, as a result of late presentation of cancers. So I want to salute Umi for doing justice. I love that part where she talked about carcinogens, where she talked about suya. There is something
well versed in her knowledge.
there is something that is a common practice all over this country, the method of preparation of suya. I don't know, maybe they don't do it anymore, but
they pour the currency too, which would have
the way they prepare this, especially this pomo, that when they want to reactivate it, when they want to bring it back to life, they use all sorts of things like car tires and everything, to cook this meat. Yes, they do use car tires, to cook this meat and all that. So there are a lot of environmental carcinogens, that we inhale, a lot of environmental carcinogens that we eat in our foods, that in the long term, very detrimental to our health.
We're taking it slowly, and it's
yes. And as individuals, we have to be aware. We have to be educated on the low-hanging fruits, on the basic things we need to do: healthy lifestyle, eating healthy, preparing your food in a good way, exercising regularly, going for medical checkups and all that. I was on the show yesterday with Umi and Hajia Husseina, and they had like an hour plus of solid discussions in Engausa, English, Hausa, talking about, preventive issues, talking about safe breast examination that every woman should know, and these are the things we need to see. These are the things we want.
Exactly.
And having this kind of discussions, I'm happy with the consistency you have employed on this program. This video will be available online. People will get to watch it. People will get to listen to it. And of course, the advocacy we are talking about is not only for us in the cancer space, it's everybody's business. It
Everybody.
is your responsibility because look, whether we like it or not, I have been the president of the Nigerian Cancer Society for 4 years now.
Yeah.
But in my household in the village, actually, I'm talking to you from the village now. You can see my camera is not on because I don't have light. Because I don't have light. In my household, within my extended family, a greater percentage of them still believe that cancer is dodgy.
Yes.
And dodgy.
Oh, growing
and
up, I used to hear it all the time.
Yes.
All the time. I'm
And
not a jiffy.
Yes, and
Daji, the second wife or the
yes,
third
and
wife.
Daji doesn't want injection. If you give injection, you are invariably sending the patient to death. And what happens at the end of the day? It is when the cancer is at late stage, invariably they will still go to the hospital, and by the time they get to the hospital, it's already terminal.
Yes.
And by the time the doctors begin to intervene and do some things to salvage the situation, if the patient dies, we said it. You know. So these are the issues.
I think that I really love the programs that they have started because it's important for us to
it's very important. It's very important because
culture that we can't talk about this because it makes us shameless.
Yes, because
Seriously?
the myths and misconceptions out there are very overwhelming.
Yes.
Very, even to the educated ones will not even talk about the illiterate ones in the society. Yes.
Yep.
So we have a lot of work ahead of us. And I can say if we have people like Umi and the members of our coalition, doing our different bits from our different areas, at the end of the day, we have a cumulative effect that will translate into tangible outcome.
I think also to help her out, Mr. President, to help her out, is her getting people to partner with her in the grassroots.
Very important.
To be her extended hand. Because as she had rightly mentioned, the economy is a factor. We can't go everywhere. Security and all of that. So if she's able to, with your support, which I know the Cancer Society organization is doing incredibly well, will actually help her to achieve that goal. Because we do need what we call the foot soldiers. The foot soldiers are the ones that will get this done. And I think for you guys, you're dealing with the big problem, and let them help you deal with the grassroots problems.
Exactly.
So I think it's really, really
and the bottom line, Khuraira, is that each and every one of us, to all the listeners out there, this cancer advocacy is not only for Unmi alone, it's not only for me alone, it's not only for Auntie Khuraira alone, it's for all of us. The little you know, try to educate others. Try to inform others. By that, we have a cumulative effect that will translate into, you see, like I said, most of these cancers, if detected early, are completely curable. Most of these common cancers. And these common cancers constitutes over 80% of the number of deaths of our people. For example, it's very, demoralizing, when a woman has her breast cut off.
Oh yes.
And breast cancer, just like cervical cancer, is one cancer that you can completely prevent.
See, people don't know,
if a woman is used to that self-breast examination, and self-breast examination is something that you don't need education, you don't need to go to school to know how to do it. By mere watching demonstration of how to do self-breast examination, you can do it. And you can do it once every month at the end of your menstrual cycle. And once there is anything abnormal, because it usually starts from a small growth that is benign, that is not cancer.
Yes.
And all they need to do is,
turn to cancer.
All they need to do at that stage is for that breast lump to go away. Once that breast lump is gone, you are good.
Yeah.
And even if it is cancer, if it is detected at very early stage 1, 2, there are procedures that doctors will carry out to make it disappear, to make it go, and you will be cancer free. But the usual problem is that attitude of hiding our sickness.
Oh yes.
Cervical cancer, for example, we have nowadays you hardly find a cervical cancer survivor. Why? Because the women think is juju. The women think is Kishia that is doing this. The women think is in-laws that are doing this, and she will be suffering alone.
Yes.
She will be suffering alone
and will not. Excuse my language. Those herbalists and making them go even astray.
Yes. And just like what Umi said, cervical cancer is a major killer of our women, and it is one cancer that has a precancerous stage. That is completely curable at the point of diagnosis. Once they do the investigation and they discover that you have a precancerous lesion, they do. In fact, there is one test they shall visual inspection with acetic acid, VIA. Is a test to examine the woman's cervix. And once there are these precancerous cells, they do a procedure to take them out immediately. And that is that. There is no more news of even a precancerous lesion, talk less of cancer.
But how expensive is it?
It's not very expensive. Visual inspection with acetic acid is not very expensive. And in fact, there are several institutions that do this test free of charge.
Okay.
And something like the pap smear that Umi talked about. A pap smear in my hospital should be around 1,000 naira.
Which is very affordable.
And there are some what do you call it? There are some just like what Umi said, discounted and sometimes even free. Free mammograms.
Yeah. And this is annually done. It's not like you're going to do it every month. You do it once a year.
Yes.
Because
I remember there was an organization that came and worked in my state of Yobe State last year. They came all the way from Lagos with funding from NNPC and Shell, I think, to come and carry out screening for breast and cervical cancer for about 500 women. So in that kind of situation, you get the test free of charge.
Yes.
So that is that. The Nigerian Cancer Society, we have entered into a partnership now with a consortium from Mayo Clinic in America about on prostate cancer.
Wonderful.
We will start a national screening program for prostate cancer.
Good.
A national awareness creation and screening for prostate cancer. And mind you, if we screen and you are positive, you have a very high level of PSA, we are not going to leave you there. We will follow you up and we'll make sure that we help you to navigate and get the best of treatment. And prostate cancer is one of the 3 cancers that Cancer Health Fund covers. Okay. And Cancer Health Fund has now been taken over by the National Institute for Cancer Research and Treatment. Mm-hmm. And we will use our machineries, we will use our the leverage we have to make sure that you get the best of treatment, And we are going to carry out this national assignment over the course of the next 5 years by the grace of God. And let me also give this breaking news for the first time on Dialogue with Khuraira.
Okay.
I will be finishing my tenure. I will be finishing my tenure as president of the Nigerian Cancer Society in less than a month's time.
Okay.
But the war against cancer continues. Just yesterday, I was appointed by the president of the Nigerian Medical Association, Professor Bala Muhammad Audu, as the national chairman of the Nigerian Medical Association's Committee on Oncology and Cancer Care. So,
congratulations.
Yes, I was a little bit depressed when you said you were finishing.
Well deserved.
What is the breaking news here? Is it depression?
I have not written about it myself. My chief of staff.
This is amazing.
My chief of staff, Bashir Rakas, I saw him. He has broken the news yesterday on Facebook. But I have not officially. I have not. Thank you so much. Yes. So now, I am telling you, as the National Committee Chairman on Oncology and Cancer Care, we are going to partner with the Arewa Cancer Control Coalition, and of course, the Nigerian Cancer Society that I have been leading for the past 4 years. To ensure, because Nigerian Medical Association, we have branches in all the 36 states of Nigeria.
Yes.
And Abuja.
Yes.
And during my tenure as the committee chairman, we are going to have a coordinator for cancer in every state branch.
Wonderful. That is the key. Is the key.
Yes. So we are going to work with this coalition to work in all the 19 northern states of Nigeria and Abuja.
Yes.
To create awareness, to amplify what they are doing. And to create that impact, because we have the umbrella, we have the Nigerian Cancer Society, and we have now the Nigerian Medical Association.
Yes.
Every doctor, be rest assured, the Arewa Cancer Control Coalition, that when you want to come to Yobe, for example, if you need 10 doctors, I can mobilize 10 doctors for you within the twinkle of an eye. Yeah. And likewise in every other state, because we have to take up this responsibility. We have to take it up and do it our way.
Yes.
And by the grace and power of God, we are going to start getting very tangible results. If you notice now, they say the cases of cancers are increasing.
Yes.
They are not increasing.
It's the awareness.
It is the awareness that is bringing people out. Even at this, if you see one cancer diagnosis in a hospital, be rest assured 100 must have died without getting access to the hospital. So the statistics on paper that we have is actually a gross underestimation, of the actual causes or cases of cancers. So I believe very soon we'll begin to have early stages of cancers being diagnosed and treated. We'll begin to have precancerous lesions. We'll begin to have early stages, not cancers actually. We'll begin to have high rate of women coming for screening. We have a national guideline now for population-based cancer registry. And population-based cancer registry, unlike hospital-based cancer registry, will report even a suspected case of cancer.
Good.
So it is now that we'll begin to have a true reflection of the statistics.
Wonderful.
So I salute the Arewa Cancer Control Coalition.
Thank you, sir.
I salute co-advocates, true lovers, true people of Arewa origin, like Aunty Khuraira, that have been doing a lot of this selfless service to humanity. Selfless service.
We have to do awareness, my brother. The problem with us,
to the benefit of Arewa, yes,
the problem
and
with
to the benefit of Nigeria.
Not to cut you off, sir. The problem with Arewa people, we are too humble to a fault. You see? And this is the reason why I have Dialogue with Khuraira, to bring the likes of you to come out and talk. Being intelligent and being educated and knowing something and not sharing is, or sharing it doesn't mean that you are baragados.
Yeah.
No, even in our religion, it says education is power. You need to educate people. And this is why I'm so happy about what you just said regarding what Ummi is doing with her organization. Honestly, kudos to you. And like I keep telling you, make sure that organization is protected now. Okay?
Sure.
All right. So make sure it's all protected.
And before I yield the floor to Khuraira, I want to say that I have appeared on Dialogue with Khuraira as the president of the Nigerian Cancer Society, and I look forward to appear again as the National Committee Chairman, NMA on Cancer. And I want to make this pledge. And I want to make this pledge.
Oh, no. Another thing don't worry, sir. This is like I have told you before. Even this month, let's say I'm busy, there is some thing that you want to discuss, because this entire month of October is about cancer awareness. You want to host it, go ahead. This is what we have to help people. We have to educate people. I'm not expert in this field. I can only ask a few things, but having an expert to drive the dialogue on what it is about is very important. You see, like there's these video clips we do, like 2 minutes video clips. This month, we will be playing your interview last year that you spoke about all the vaccines, because you said a lot of educative things in those little clips. So we'll be playing it every other day. There will be a new clip. And there's one that Ummi did, and there's a gentleman that also did in Ghana, who also did brilliantly regarding this the different kinds of cancer. But I think that having the people like you being in the driver's seat will really make a huge difference. And I honestly applaud you both for what you're doing in that space, and having this program, Ummi, that we women should be able to freely talk about their bodies without feeling shame. It's what will save a lot of our families. Because you see, the cancer doesn't just affect the person that is sick. It affects the entire family. Because if you have a cancer patient, remember the lady that you talked about, who has to sell things to go to do her blood work, to start even selling to you guys. She didn't have an option to stay home. Her children in the process were suffering. Her husband, it's a whole circle. So having to have this awareness, and if we can even reduce it to 25%, we have done something. And to let people understand there's no daji, there's no kishia, there's no family members. It's real disease, you know?
That's true.
Well, congratulations. And the other thing that I wanted to also congratulate you again, I saw our Excellency Dr. Zainab Bagadu had been elected. Can you please share that information with our...
She gave it a shot 2 years ago. We couldn't make it, and we didn't relent in our efforts to push. The Union for International Cancer Control is the world cancer governing body, just like the United Nations. It is our United Nations of Cancer. And the organization has been existing for over 90 years.
Wow.
This is the first time a black person emerges as president-elect. The first time an African emerges as a president-elect, and for that matter, a Nigerian.
And a woman.
And a woman.
But I have to tell you this, though. Zainab had paid Dr. Zainab had paid her dues. You know, first time I met her, first time I met her in Houston, and was in Houston when we did an event, and that was 2015 or 14. I think 2014. And she spoke about, I think she she had just started her NGO at that time. I actually did a fundraiser with her where she got some of the product where we, Khuraira Cosmetic, in 2015, where we did a campaign, Walk Away Cancer. Is it Walk Away Cancer? Walk Cancer Away or something. And she, from then, she's been passionate of what she's been focused and driven. I think there's no way, hands down, she deserved that title.
It was not
pain abuse.
It was not out of place when last year during our annual dinner, the Nigerian Cancer Society conferred on her an award as the Global Cancer Ambassador of the NCS. Wow. So we are excited. We are in a state of jubilation. In fact, that was the reason why I downplayed the news of my appointment as a committee chairman of NLD, because we are still in celebration mode.
We're still in celebration. But your assistant Raskas cannot let us rest. You must let it go. You must let the cat out of the bag,
Yeah.
But it's a lot to be celebrated. Celebrated. And I am, with the three of you, Dr. Zainab, you, Dr. Adamu, and my dear daughter here, Ummi. I wish we had met Usaina, but I'm sure one day we'll meet her soon before the cancer month is over. There will be a lot to be done. And I am happy that there's somebody that mentioned that there was a hospital teaching hospital in Baraudiko in Kaduna that is also offering the free cancer screening. So which is excellent. And then I know that I think there's somebody I don't want to mention yet, but I will send you her information, Ummi, to reach out to her in Kaduna, because they are involved with the cancer. They have a cancer clinic, so I'm sure you will be able to collaborate.
And something I mentioned yesterday on the coalition's program. Especially as it relates to federal government workers. Not only federal government workers, every person that is enrolled into the National Health Insurance Authority, national insurance. Because, as an individual with, I think, as little as 15,000 naira, you can register and get insured for a year. Once you are covered, once you are covered, you have one free medical checkup per year.
But you see, this needs to be made really, the awareness should be very broadcast. Is there a way you guys can write something up in that format where we can actually share it on our social media contact, with our social media contact? Because this, I briefly heard about this during Onga, when His Excellency, the governor of Plateau State, was telling the diasporans that they should invest into the national insurance scheme. So nothing much was said after that. And now you are mentioning it. I'm understanding. And if it is not that expensive, one person can buy at least for 5 or 6 of his family member.
Exactly.
And paid, and then we don't have to worry. I hope the money will be used for what it's supposed to. That is the fear, I hope the national insurance scheme will be real and will be transparent, that the money will not be siphoned to something else. Because a lot of the countries here, for example, of course we all pay for insurance. No matter, maybe some expensive that are private, but the government ones are not expensive. But you pay a little bit of something to be able to, because they have to pay the staff, they have to run the clinic. So if they're going to give everybody everything free of charge, then how are they going to function? So that is wonderful. Please, if we could have information about that, what account it needs to be paid to, we will encourage some of our blessed friends to even start maybe supporting and paying for their family members or people that even work for them, because
individuals, there are individuals that are already doing that. We have the likes of Dr. Aminu Garba Magashi in Kano. He has this cancer trust fund that he established, and he pays insurance for, I think, about 100 people every year.
See,
and these people are drawn from the vulnerable in the society.
Yes,
and insurance is business. Once you are insured, the target of insurance is for those that are healthy to pay for those that are sick. So it's very important.
But having to know about it is very important. So the awareness is not out there a lot, because this, I'm telling you, this is the second time I heard about it, and this is the first time I heard detailed explanation of it. So do you understand? Knowing that the kind of people we even have in our platforms, if we're not even hearing about it, it means it's not communicated very well. So I think that should be the focus, having a lot of awareness on it and encouraging our people to pay for those that are less fortunate to be able to do their yearly checkup. This will also make your jobs easier.
And health insurance, health insurance in Nigeria is now compulsory.
Yeah. Health insurance is not compulsory?
It's compulsory now.
Oh, good.
The act has been amended. It's now compulsory. And in fact, there is a provision in the new act that has provision to cater for vulnerable age group, the aged, and the children. I think about 72 million Nigerians are supposed to be covered under that vulnerable fund. So we are pushing for more to be channeled towards cancer is a very expensive disease. This is why and this is why you discover that
there are a lot of disease is expensive. That's why they say health is wealth. Being healthy is wealth. So if you can prevent it, better prevent it before you get sick. That's it. So please, we await for that information so we can share it in all our different platforms to get people aware of it, with all the necessary information that they need to know to get to sign up. I think it's good if we keep doing that to get people enrolled. That would be wonderful. And for you, Umi, finally, can you hear us now? You can hear us now? You still can't hear me, right?
I can hear you, but not completely, but I can make out what you're saying.
Okay, all right. Well, thank you so much. Well, you did a fantastic job. You did great. And Doc, thank you and congratulations once again. And I look forward to seeing you again this month somehow. I'm sure you'll be back to tell us more.
By the grace of God.
Yes.
I'll be happy to.
Yes. Thank you so much. Have a wonderful evening, everyone. And all the best in all that you do.
So much.
May
God bless you.
Thank you, sir. Thank you so much. Mommy, thank you.
Thank you, Umi. Well done.
Welcome, Umi. Congratulations on all of your accomplishment. Very proud of
so
you.
Much.
Yeah. Thank you. Now good.
Bye-bye.
Mashallah.
And Rufai, so did you hear our doc? We need to make sure our doc is on the schedule for October to come and share the great news, and we're very, very excited for him and excited for actually Nigeria. It's a great thing to hear about Her Excellency Dr. Zainab, Her Excellency Zainab Gudu, and also Dr. Umar for these appointments. And may God make their appointment to be something of greatness that would uplift the lives of many and make us all Nigerians proud. Thank you. And thank you, everybody, for watching. Sorry that we were slow. It was, but we were insisting we must have this show, and we did it. So thank you, everyone, for being patient, and our program manager, for also working behind the scenes. Thank you, and have a good night, everyone. Bye-bye.
Bye.